So with that, we move on to the next speaker on Ms. Mary Sung. She'll be presenting and talking to us about empowering rare disease patients, the journey of rehabilitation, innovation, and social inclusion in China. Ms. Mary is a child and family psychologist who has served as the technical director of our Family China since 2012. She chairs the Child Psychology Committee of the China Association for Rehabilitation of the Disabled and is a member of many regional professional committees. Our Family China provides professional rehabilitation and social inclusion services to rare disease patients living in a variety of geographical and socio-economic contexts using a holistic and community-based approach. Over to you, Mary.
I am very soon come from China, and this is my presentation title today. And I'm very happy to share with you about the empowering rare disease patients, a journey of rehabilitation, renovation, and social inclusion. Today, I will, from the three parts, to share this topic, these topics are who we are, the rehabilitation services for persons with rare diseases, and social inclusion. Okay. Who we are? We are a non-profit civil society organization, which is CSOs in China. We focus on children rehabilitation, inclusive education, and promotion, and supportive employment for young adults with special needs. And this was a cooperation project since 2008. There is a Italian organization, which is OVCI, is also an NGO come from Italy. This is a national international cooperation project, and with their support funded us. And during the 2012, we registered as a local organization. After that, we immediately have the cooperation with another organization, NGO, focused on rare disease, which is China Doors. Here is their logo. This is our starting stories. And during these years, the rehabilitation services we provide for persons with rare diseases are like this. First, let me introduce some situation in China. As you know, rare diseases are a group of diseases which extremely low indices and a small total number of patients. 71.9 are related to genetic conditions, and 69.9 become manifest in childhood. Rare disease epidemiological data vary gently worldwide, and there is currently no universally recognized unified definition of rare diseases at the international level. In China, 2018, we first related the first batch of rare disease list, which included a total of 121 rare diseases. China's rare diseases population is about 20 million people, and they all have needs in rehabilitation, education, employment, and pharmacological and other medical treatments. I think rare disease people need this. This is a common needs for everyone. And when we see all this big number and all these needs, so we start to deliver our services in order to answer these needs. So we start to provide this kind of community-based rehabilitation services. And in this service, we started in 2012, we met the first rare disease patient organization, China Doors Rare Disease Center, which focuses on osteogenesis imperfecta, which is always known as OI. Since 2013, we have served more than 1,000 persons with OI and other rare diseases. We have been providing family and community-based rehabilitation guidance, psychological services, and assistive technology matching and adaptation for persons with rare diseases. As you see these photos, like this OI child, bring by family come to us, we will provide the total holistic evaluation and teaching to the parents how to do rehabilitation for them in home. And if it is necessary, we will match some assistive technologies, devices for them in order to facilitate their life and to go to school. Anyway, China is quite big. And if we try to move all these big patients go around China, it's our total move to Beijing is something quite difficult. So with partners like OECI and China Doors, we together always establish a group, and we start to divide China in several areas. And this our professional tip group, we together go to each area, and in this way, like each places we reach, and to provide some training, some treatment, evaluate the patient, provide them guidance to the children and family, and give some professional trainings for the local people. Anyway, in these years, we already traveled more than 30 cities around China to provide this community-based style rehabilitation and training the local people. Something we would like more underline is during the epidemic period. During the last 3 years, due to many reasons, since we cannot go to the places, local places, so we opened the online service. So during this epidemic period, online rehabilitation guidance was provided to more than 1,000 families, and of course, more than 1,000 hours. And this is quite welcomed. Even after this epidemic period, these online services we are continue providing, and it's something good for us. Particularly for the OI, since they are very easy to get fracture and easy to have some problem of the breathing or other issues. So we providing them the hydrotherapy camp. Usually this kind of camp are 3 days. During these 3 days, we will provide the children, first teach to the parents, make them able to stay in the water, able to swim, of course, do very simple swim. Then secondly, we start to put the children also into the water, to able to breathe in the water, able to flow in the water. And the end is increase their relationship between child and family. And in this way, yes, in the water can improve the physical issue, the physical healthy of the children. Then they are laughing, increase their breathing. They are happy. It's a beautiful, enjoying game. And this kind of services no need master in Beijing or where you can do. In China, there are a lot of swimming pools. They can do any kind of swimming pool near their home. So this is a very good way to empower the family. Above all, also during these 3 days, we will organize some moments, like during the evening, provide some parents group, like a parents workshop, to make the parents to speak each other, share each other, provide some psychological help. Anyway, with this kind of help, the families become a group, become a unity member, and in this way, they become more and more open, more and more communication.
2 minutes.
5 minutes, right? Okay.
2 minutes.
2 minutes. Okay, it's okay. Then the third one is social inclusion. I would like to just show you this case. After this is our study. After this hero therapy program, the children already more and more like active, positive, and they reduce the fracture and they more openly. Then after the few years, he go to this Leo, he go to school, even with assistive devices, but he go to school. This was many years ago, his picture. Now you can see this is 2023, which is last 2 weeks ago. He is already in college and is a role model for others. This is him. He already in a conference with me. And above all, we also do many family empowerment, like I have a date with Summer, where this is family meetings. This picture, we put together the families and we organize many activities for them. Even this is a hospital, but we continue to consider this kind of mentality, make the children happy, like these activities. And we also do some social advocacy activities. Like on the February 28th, the International Rare Disease Day, we just go to the public places to share more information with more public people to make them know about rare diseases. Anyway, we believe the more we make them know, the more will change. Anyway, we believe together we can do more. This is my sharing today. Thank you very much.
Thank you, Mary. Reaching out to across geographical areas and different socio-economic groups and how CBR plays a critical role in that is a key message, and also the need for looking at children. I mean, the focus on children in terms of ensuring assistive devices and adaptations at the home and education and the different environments they access is a very important aspect of the discourse. Thank you so much for that.